GBMC RX, prescription for a healthier you. GBMC's cutting-edge technology using robots is helping patients heal faster and surgeons be even more precise. Dr. Emily Waters is a bariatric and general surgeon at GBMC and chair of the Robotics Committee.
So the Da Vinci system is a robotic surgical platform. Basically, it allows surgeons to do major surgery through small incisions, 3D versus 2D visualization, a better articulation of the instruments. When we're doing laparoscopic, which is also minimally invasive surgery, we can't angle our instruments 360. With the robot, we can go 360 with the instruments.
Utilizing the Da Vinci robot in her surgeries has been a game changer.
So for me as a bariatric surgeon, it helps, especially when I have higher BMI patients. I'm really able to get the exposure I need to safely do my surgery. And then also as a general surgeon, it's really helpful when I do big hernias. It used to be you would have to make a big incision, they'd be in the hospital a couple of days, they'd have a drain, all this stuff. But now with the robot, I can do those hernias through small incisions and the patient goes home the next day.
And she's not the only surgeon singing its praises. The Da Vinci is helpful with numerous practices.
Urology uses a lot for prostates. That's actually where the robot first got started, was with urology. So our urologists use it all the time. Gynecologists as well. Our gynecologists who do oncology cases, they find it very useful to do their dissections with it. Colorectal as well use the robot. Another big benefit of the robot is that we're really able to do a deep dissection in the pelvis and up in the near the esophagus. I do a lot of hiatal hernias, and it's super important that I have precision when I'm working near the esophagus. Same for our colorectal and gynecological surgeons. When they're operating on the pelvis, it's a really small space, so the robot allows us to get really deep and precise with our movements.
So does the robot cut down on the actual surgery time?
Whether the surgery takes shorter or longer time really depends on the surgeon, the procedure you're doing. I'm a little faster on the robot for my gallbladders, but for my bypasses, I'm about the same. So it really just depends on the surgery.
One thing that is for certain, though,
we are still doing the surgery 100%. We're not quite there yet where you just type in the surgery, gallbladder, and the robot does it. That may be in the future, but we're definitely not there yet. So as a surgeon, I put in the ports, I make the incisions, place the ports where I want to go, I attach the robot, and then I sit down on a console and I do the surgery, controlling the arms. So the surgeon is 100% still in control of it.
In control, but the sitting down part is a welcome relief.
Traditionally, when we were doing surgery, either open surgery, you're a little hunched over the patient, laparoscopic, you're standing at the patient's bedside, and that can get really tiresome, especially when you have higher BMI patients and you're really working against the abdominal wall. But with a robot, you sit down and you don't feel that pressure on your body, on your shoulders, so it's really better on the surgeon's ergonomics.
If you think bariatric surgery with the Da Vinci could be the right move for you, the first stop is to GBMC's website.
They can sign up for a virtual appointment with myself or one of my partners, and that really gets the ball rolling. And then they will do nutrition classes, they'll meet with their primary care doctor, and they'll get set up for bariatric surgery. For more information, go to gbmc.org/weight loss. We'll be right back with more Midday Maryland right after this. Stay tuned.